Stephen Dorrell, former Health Secretary, speaking to us a little earlier. Well, let's now speak to Lucy Johnson, who's Health Editor at the Sunday Express. Lucy, thanks for joining us once more. I'll just give you this news we're getting through from the Health Secretary, Steve Barclay, saying he will meet Pat Cullen, the boss of the Royal College of Nursing, today to try and get some kind of deal going. Basically, we're being told he's not going to negotiate on pay, according to sources. Instead, it's understood he'll discuss with her how nurses' working conditions can be improved this winter. That's unlikely to cut it, is it?
I think so. It is a worry. I mean, I have every sympathy for the nurses, and of course, if their costs aren't covering even food and they're eating leftover food and going to food banks and can't afford to drive to work, they do need to have more money. I think that the timing of this is a real concern. We're coming into winter and we've already seen a surge in not coronavirus, but other respiratory viruses, which are coming on. That coronavirus isn't the only threat. So influenza, rhinovirus, adenoviruses, RSV, which is a virus particularly hits children. And we know that there has been an increase even compared to last year with these viruses, which is believed to be because of the immune debt that we have because of the lockdown. Viruses of course, don't just go away, but we've got, more susceptible pool of population. So we are in real trouble coming into winter. And if the nurses could have perhaps done some effective campaigning to increase their pay over a period, perhaps it wouldn't hit patients so hard. Although, having said that, I absolutely get why they don't want to strike. Yeah. They would never want to harm any patient.
But is it really the right negotiating ploy at the moment to go in and ask for 17%? Mr Barclay has indicated that could cost the government £9 billion when people are facing this problem of actually making ends meet. Saying the government literally can't afford that.
Well, I mean, I'm no economist, and we have easily spent money quite quickly, haven't we, on other things with low value, such as the test and trace. Many of the COVID measures, we just chucked out money, 37 billion lost to COVID fraud. But, this isn't about COVID. I think this is probably not. I mean, it's going to be a stalemate, isn't it? Those nurses are demanding that. But I think perhaps some kind of compromise, seeing an increase of a certain amount over 2 years, for example, might cut it. It is possible that this is not going to work. But the effect on the health system, which, as you've said, is already in absolute crisis, is going to be enormous. And coming into winter, it's I can't imagine what the consequences will be. We all know we've already got thousands of excess deaths, over 1,000 excess non-COVID deaths every week. So and people will waiting, as you say, 7.1 record numbers on the waiting list. So it's only going to make that worse.
And the possibility of a flu epidemic, bearing in mind what's happened in Australia, of course. But at least talks going on, it seems, so we'll see what emerges from that. Lucy, for the moment, thanks very much for joining us here on GB News Live.
Good to see you.